there, I'm Teresa Dufour with your CT Style Express. There are 180,000 new cases of prostate cancer in the U.S. each year, and many Connecticut residents turn to Middlesex Health for care. Here with details is Middlesex Health urologist Dr. Edward Meyer. Dr. Meyer, thank you for chatting with us and making time for us today.
It's my pleasure to be here.
All right, so we are going to get the ABCs here of prostate cancer. I want to ask you first, what are some of the causes? Is there anything we could do to prevent this?
Well, prostate cancer, the biggest risk factors for prostate cancer tend to be age and family history. The average age of diagnosis for prostate cancer is 65, and men are more prone to getting prostate cancer as they get older. Family history is also very important. If you have a first-degree relative who's had prostate cancer, such as a father, brother, even uncles and grandfather, you're more likely to get prostate cancer. Similarly with breast cancer, if you have a first-degree relative who's had breast cancer, you're more likely to develop prostate cancer. There are some environmental exposures that have a loose association with prostate cancer, such as smoking and obesity, but it's not a very strong association at all. The two most important things, age, family history.
Are there any symptoms to be on the lookout for?
Prostate cancer tends not to show up with symptoms until it's a little bit too late in the game. This is why screening is very important. Symptoms that we typically associate with prostate cancer are abdominal bloating, pelvic pain, difficulty urinating, back or bone pain, weight loss. But again, that's usually pretty late in the game after the prostate cancer is pretty widespread.
Sure. So, Dr. Meyer, when should a patient first get screened?
Generally, we recommend starting at age 50. The men who have the biggest benefit of prostate cancer screening are ages 55 to 74. Although if you have a family history or are African American, we recommend getting a baseline PSA in your 40s.
Okay, and what are some of the treatment options if you do have to move forward?
Many men don't have to be treated at all. About a third of men in my practice are diagnosed with very low or low-risk prostate cancer, which we tend to just watch and really don't need any treatment at all. For men with intermediate and high-risk prostate cancer that's localized to the prostate, treatment options include surgery, or complete removal of the prostate, or radiation, essentially cooking the prostate with high-dose X-rays from the outside.
Doctor, what are some of the features of the Middlesex Health Cancer Center?
We have an excellent cancer center for a community hospital. The cancer center offers nurse navigation to help people navigate all the complexities of the medical system, as well as alternative therapies and support groups.
Sure. And what is SpaceOAR all about?
SpaceOAR is a way to mitigate side effects of radiation. Radiating the prostate, the radiation can affect the rectum, and SpaceOAR is a gel that gets placed between the prostate and the rectum, pushes the rectum and prostate apart, and this way the radiation oncologists are able to radiate the backside of the prostate more effectively without hitting the rectum and causing a lot of bowel symptoms like frequent or loose stool. Dr.
Meyer, I know we're in the middle of a pandemic right now. What would you say to a patient who's kind of reluctant to get the screenings or even the care that they might need?
Definitely keep up with your medical care. Medical care is safe. Everyone's taking their precautions. So even if you're reluctant to go out of the house, you can feel safe at your doctor's office. And I still recommend getting routine screening. There's a lot of controversy that exists about prostate cancer screening in general. But I think with judicious use of screening, we're able to sort out men who really need care from those who don't necessarily need immediate treatment.
Sure.
So do go ahead with screening, and we'll be able to determine whether or not you need care.
There you go. Take care of yourself, even during the pandemic. Dr. Meyer, thank you so much for chatting with us. And of course, you at home can learn more at middlesexhealth.org/prostate cancer. We appreciate it.